Hello, my name is Nikki Halemano, and thank you for joining me for this consultation session. My client is Elizabeth Dewitt, female, 19 years old, no religious affiliation, and currently a university student in New York. Elizabeth has no history of smoking alcohol or drugs and is living by herself in a small apartment close to her school. Up until her admittance to her university, she was living with her father and stepmother, who recently passed away. Elizabeth came in seeking help because she continued to experience distressing, strange occurrences in her home that were beginning to affect her everyday life. She reported that although she lived by herself, she noticed ashtrays full of recently snuffed cigarettes on some mornings, along with makeup she had never bought before. Although she had attempted to get rid of those items, the ashtray, cigarettes, and makeup, they would always come back sooner or later. On the morning she came in seeking therapy, she said that she had found herself wearing the makeup when she awoke that day, although she had no recollection of putting it on. As we continued to speak, I asked Elizabeth about her personal life. She communicated that she was currently single and did not have any close friends, and none of them had ever been to her apartment, much less knew of its location. She also disclosed that she strives to become an artist and study abroad in Paris one day. When asked as to why she decided to go to school away from home, she explained that her father did not agree with her decision, saying that it was typical of him to try to keep her locked away. When I prompted her to speak more on why this was typical of him, Elizabeth began to change. Her posture became more assertive and her features became more mature. I almost believed I was sitting in a room with a completely different person. This woman, although bearing the same appearance as Elizabeth, was called Noir, and she explained that Elizabeth had been locked away in her room for a very long time by her stepmother, who detested her existence. Her father did not try to help her, but instead used her as a test subject for products created by his company, which included various pills and drugs. I asked Noir about the cigarettes and makeup, to which she replied that they were hers, and she did not understand why Elizabeth threw them away. Noir also urged me to ask Elizabeth about Anna. When Elizabeth returned to her original state, I prompted her to tell me about this Anna. According to Elizabeth, Anna was an infant who lived in the apartment next to her. The baby never stopped cooing and crying as if no one was there to take care of it. She reported feeling haunted by the sounds and feeling extremely sympathetic to the child. When asked as to how she knew the baby's name, Elizabeth replied that she just knew it. Upon further investigation, there is in fact a couple living next door to her, but they do not have a baby and have not had one in the past. After the session, I reviewed my notes and have decided to diagnose Elizabeth Dewitt with dissociative identity disorder, also more commonly known as split personality disorder. According to the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5, a person can be diagnosed with dissociative identity disorder if they have a disruption of identity characterized by 2 or more distinct personality states, recurring gaps in their memory of current everyday events that go beyond ordinary forgetting. The symptoms cause significant distress or impairment in important areas of functioning. These symptoms are not caused by religious practice, child fantasy play, or by physiological effects from a substance. Elizabeth has shown to have 2 distinct states of being and potentially a third one. The first being Elizabeth Dewitt herself, Noir as the second, and Anna as the potential third. Elizabeth has no recollection of what Noir does when she manifests, evidence of this being that she does not remember ever smoking or putting on the makeup that belonged to Noir. The events have certainly bothered Elizabeth to the point that it has affected her schoolwork, and there is no evidence of these events resulting as a reflection of religious practices, fantasy play, or substance abuse. The treatment options I have in mind are 1, Gestalt therapy, and 2, a multi-phase treatment that will include behavior therapy, cognitive therapy focusing on her traumatic past, exposure therapy, and a final treatment phase individualized for Elizabeth. I have chosen Gestalt therapy for the first intervention plan because Elizabeth clearly deals with a traumatic past that she has not come to terms with. I feel that perhaps by working with her on accepting this part of herself that may have been caused by the trauma, it could eliminate the need for the other personalities. I believe that Anna could be a representation of her younger self, having been neglected and abused by both her father and stepmother for some time, and that Noir is a manifestation made to protect Elizabeth from the psychological harm of abuse that she had faced, having a more mature, cold, and calculating personality. The second multi-phase treatment was brought to my attention when I realized the need for not only therapy to help Elizabeth come to terms with her trauma, but also the necessity of exposure and integrating the personalities into one, or helping Elizabeth find a way to live alongside Noir and Anna. Dr. Prant and his team conducted a survey of 36 clinicians whose expertise was treating patients with dissociative disorders in 2011. They recommended this phase-oriented treatment that consists of 3 steps. The first step is to help the patient learn how to handle high-risk and potentially dangerous behavior, emotional and impulse control, as well as interpersonal effectiveness. At this stage, we will also attempt to reduce cognitive distortions linked to Elizabeth's past trauma and working with the dissociated identities Noir and Anna. The second step will include exposure therapy, where we will gradually confront Elizabeth's traumatic experience and work on desensitizing her to that type of stimulus. The last step is where we will attempt to integrate the personalities into one, or find a way for Elizabeth, Noir, and Anna to live in harmony. This concludes my report on Elizabeth Dewitt, and I look forward to hearing your input on the methods we should use to treat her problem. Thank you.